should maybe strike that and say great afternoon. It is a monumental day here in Indiana, and I'm just thrilled to be at Eskenazi Hospital, home to the Midtown Mental Health, something we're very proud of, and to be able to be here to make this announcement is just so appropriate. This is not just a historic day for what we're about to hear from Secretary Azar, but it's also a historic day for us to be able to welcome back Secretary Alex Azar back home again in Indiana. It's been just over a week, I guess, now that you've been on the job, and for you to determine that you would make this one of your first ventures, one of your first announcements around the country, we are certainly proud of that. So without further ado, would you please share some details about just exactly what it is you're here back home in Indiana again for? Secretary?
So thank you so much, Governor Holcomb, my good friend. Good afternoon, everyone, and thank you for inviting us to Indiana today. It's great to be back home here and to bring greetings to all of you from President Trump and from that other Hoosier who happens to find himself now in Washington, Vice President Pence. In fact, I spoke just the other day with the Vice President about this program that we are going to be talking about today. He was very excited about it and was delighted that it was going to work out for me to be able to be out here with you for this. I do want to thank Governor Holcomb and his entire team here in Indiana for having us here and for the great work, the hard work that they have done to build this program. Thank you also to everyone here at Eskenazi Hospital for welcoming us to. Just an incredible, beautiful, state-of-the-art hospital that we've got, that we are privileged to have here in Indianapolis. So just a real gem of the public health system. So thank you very much. It's fitting to be here today for this announcement in one of my first appearances as Secretary of Health and Human Services. Let me explain why that is. Today's announcement is just one significant step in a long legacy of innovation in person-centered health care that stretches back across 3 Indiana governorships, beginning with Governor Mitch Daniels, then under Governor Pence, and now under my friend Governor Holcomb. Indiana's vision and ours goes beyond the provision of quality health care. It recognizes that Medicaid can become a pathway out of poverty, paving the way for better long-term health for all enrollees. We can only make this vision a reality in cooperation with states like Indiana. And it's a crucial piece of the mission that we have at HHS to protect and enhance the health and well-being of all Americans. This mission goes beyond just HHS's health programs. Through our work in human services, substance abuse treatment, and disability programs, we take a very broad view of ways to help improve the health and well-being of all Americans. Healthy, fulfilling lives require not just health coverage and health care, but also a sense of purpose, often obtained through work. We all know this intuitively, but there is a robust body of academic evidence to show that work is a key component of well-being, and that insight has long been at the core of our programs at HHS. That's why we're so eager to be here today to announce that the state of Indiana has officially been granted approval for its new version of the Healthy Indiana Plan, or HIP, a 3-year extension of a program that has already helped so many hundreds of thousands of Hoosiers. The new demonstration includes the historic step of work or community engagement requirements for able-bodied, working-age adults, and this in particular is going to help open new opportunities for a lot of Hoosiers. HIP's community engagement and work requirements only apply to a small segment of the Medicaid-covered population, work-capable adults. This is actually a limited piece of the Medicaid program, but it is a huge population all by itself. Indiana will be working with 130,000 able-bodied adults who will now have opportunities and incentives to find work. Many of them are working now, but many are not. At HHS, we've issued guidelines for all states interested in these kind of waivers that have careful protections for Medicaid enrollees struggling with particular health problems, including substance abuse, which we know represents a challenge for many Americans and many Hoosiers. And this next phase of HIP goes beyond just work requirements or community engagement. Importantly, a substance abuse component of the waiver to allow Indiana to expand access to certain treatment sites for those struggling with substance abuse, including opioid addiction. In addition, we have further development of consumer-oriented features to put people in charge of their own health care and to learn the skills of managing your own health and health insurance. Healthy Indiana's results have been impressive with regard to nearly every challenge we see in Medicaid, from overuse of the emergency department to challenges with chronic disease. Healthy Indiana has shown progress and promise. We look forward to working with Indiana in the years to come to assess and improve this program and with other states to devise programs that work for them. So that's why we're here today, to celebrate Indiana's record of innovation, to mark the start of a new era for the state's Medicaid program, and to express our commitment to an enduring partnership to improve the lives of those we serve. With that, I'll hand it back to Governor Holcomb. Thank you and congratulations.
Thank you, Mr. Secretary. Thank you very much. This is wonderful. Well, there you have it. HIP is here to stay. And as Secretary Azar mentioned, for over a decade, HIP has been a national model for healthcare coverage and a program for the rest of the nation to take note of. And with today's announcement, we're going to be able to continue, most importantly, giving folks the peace of mind to continue this coverage for over 400,000 Hoosiers already enrolled in this program, giving them that certainty and that security, knowing that their health care needs are going to be covered for the foreseeable future. So for that, we are eternally thankful. But that's not all. I want to assure Secretary Azar and the over 400,000 HIP members that we are just getting started. We are going to be making improvements along the way that we're now able to do. And we are at the, I think, at the, as Secretary Wathel has described before, we are starting to go from walking to running with this program. And so we're not done. Far from it, in fact. We're going to make HIP even better and more responsive to Hoosiers' needs. And we're going to be dedicating additional resources to this most pressing issue that we all face together, and that is the opioid epidemic and the crisis that we're all facing on multiple fronts. We're, of course, taking action already on three fronts: on the prevention, on the treatment, and an enforcement fronts. And with this HIP approval that we learned of today, we're going to be able to infuse an additional up to $80 million a year for 3 years. That's, do the math, $240 million, up to $240 million that we'll be able to make sure that HIP members have access to this additional treatment and those resources that go along with it. So it's not an overstatement to say that this is not going to just change lives. This, in fact, is going to be able to save lives. And that alone is enough for celebration. But I would say, hold on, wait. There is still more. We're going to, along the way, as I alluded to, we're going to be making some changes, and we're going to be working to make the process even easier for members, eliminating some of the current or previous burdensome administrative procedures, making it easier for HIP enrollees to contribute to and to take charge of their own health care. And we're going to be able to begin to start connecting members to, as Secretary Azar articulated, to training, to potential work, to education. Here in Indiana, many of you have heard me say before, we have almost 90,000 unfilled jobs. And we're adding to that on a day in and day out basis. Last year, 2012, broke the record and added another 30,000 high wage, high demand jobs to that equation. So filling those jobs is truly going to take an all hands on deck approach. And this Gateway to Work initiative is going to help connect eligible HIP members to the very training that they need to take that next step up so that our state, in fact, collectively can fill that pipeline and we can take the state to the next level as well. We know that work plays a central part in that, and we want to appeal to an individual's highest aspirations, and this is going to go a long way in doing just that, connecting enrollees with those employment opportunities that exist there right now, and that in turn will help to improve their quality of life, and I don't think it can get any better than that. So, you know, it always takes teamwork, and we're looking at individuals in this room here that came together a decade ago and had a new idea, had a new plan, and came together, devised it, we implemented it, and here we find ourselves again. And I want to underscore just how thankful I am that everyone has been here from day one, constantly seeking to keep the member, that enrollee, at the center of it all, and to figure out how we can take that person again up the next steps. It started with, as you mentioned, started with one of my predecessors, Mitch Daniels. Will forever be one of his legacies, and then it was in fact expanded upon my immediate predecessors, the Vice President, Mike Pence's watch while he was governor here. Along the way, we've kept the enrollee at the center of all the attention, and that's why this plan, the Healthy Indiana Plan, has become the gold standard around the nation. Again, teamwork, and at the center of our team has been Secretary Jennifer Wathel. Dr. Wathel and her whole team has been focused on making sure that we arrive at today. And here we are, and so would you please share a few more details at the granular level about what exactly this program means and how we're going to make it even better starting right now.
Thank you, Secretary Azar, Governor Holcomb, for the opportunity to be here today. Thank you, everyone, for being with us today. I'm grateful to our team, to our healthcare community, to our HIP members who helped us to today. Thank you for the support of the governor and our federal partners as well. We really are grateful for the opportunity to continue Indiana's Healthy Indiana Plan with three very important improvements: expansion of substance use disorder services, easing the administrative burden of the program, and enhanced community engagement. Until today, Indiana has provided a broad range of services for HIP and Medicaid members struggling with opioids or other addictions. We've provided medication necessary for treatment, and we've also made outpatient treatment available to people. We've also covered certain hospital stays or other facilities for an inpatient stay for a limited amount of time. But it's been in bits and pieces. Until now, many hospitals that are focused on treating mental health or addiction have not been able to accept HIP or Medicaid members, or they've had to limit the number of beds that are available for addiction treatment. Now, with this approval, we will be able to allow both HIP and Medicaid members to access these facilities. Some of these facilities offer inpatient treatment for people who have significant medical issues that need to be controlled due to substance use disorder, while other facilities will be available for individuals who need residential treatment, a safe environment for a period of time to help their substance use disorder move into recovery. For our members, this is about giving them access to more hospitals and other facilities to help them recover, as well as expanding access to recovery opportunities in their communities. When our Open Beds 211 partnership goes live in March to complement our already updated and interactive website and our Indiana Addiction Hotline, 1-800-662-HELP, we will have the connectivity and the infrastructure to meet people where they are. Currently, HIP provides health coverage and peace of mind for more than 400,000 Hoosiers, and the vast majority of them are engaged to the point that they choose to pay a little of their own income so they can have the best benefits. This next iteration will make it even easier to be a HIP member. We've streamlined many processes so that members can take full advantage of their improved health access options. As part of our goal to integrate all aspects of health into our social services programs, we will be asking some Healthy Indiana Plan members to participate in the expansion of our Gateway to Work program. This program helps connect its members with job training and job search assistance, education, community engagement, or work opportunities. Starting in 2019, unless a HIP member falls into one of many exempt categories, such as being medically frail, pregnant, in treatment for substance use, or having a child younger than school age, we will help HIP members go to school, find new training opportunities, volunteer, find a job, or participate in many other qualifying activities. This is a change for some HIP members, so it won't take effect until after a full year of ramp-up and discussions with all of our community partners. We will build this program thoughtfully and communicate it clearly. We want HIP to continue to be what it's already been for so many, the pathway to what comes next in life. We're building this with an intentional goal of having 0 people have their benefits suspended. We will do this by taking an individual approach to meeting people where they are and connecting their hopes for the future with solutions and supports. Indiana has outstanding workforce readiness, job training, and educational programs, and we look forward to strengthening these existing programs and partnerships while also building new ones to assist HIP members in the way that best meets their needs. The Healthy Indiana Plan is a powerful tool for help. We look forward to watching it continue to grow and thrive as a foundation to take us to the next level in healthcare with compassion, innovation, and the Hoosier spirit at heart. Thank you.
Any questions?
Well, as you know, we recently approved a community engagement model also in the state of Kentucky, in the Commonwealth of Kentucky. And I believe we are already engaged in discussions with requests from 11 other states for community engagement programs such as the Indiana and Kentucky programs. And these are from governors on both sides of the aisle. So it seems to be getting a great deal of excitement as a way to deal with, as Dr. Walthall said, the social determinants of health, to bring people up and help them out of dependency into independence, those who can, and give them that helping hand to move forward through education, community engagement, volunteerism, and work. So thank you. Sorry, I couldn't hear the question.
I'm talking about the 70 plus the 10.
So when we talk about the increased resources coming to the state, just to make sure that everyone's clear, the substance use disorder package of this application actually applies across all of our Medicaid population. So it's not just for our HIP members, it's for all of Medicaid, which is what makes it so incredibly exciting for us as we really raise all of the boats for substance use disorder. So when we project the number of individuals that we think have substance use disorder across the state that are enrolled in our program, that's where we get that estimate. And so each of those buckets will come from the way that the match occurs at the state and federal level, in the enhanced match in the HIP program, and at the Medicaid match for the remainder of our Medicaid program.
You might want to just elaborate on it's up to that.
Correct. Right, so that's an estimate. Obviously, this is not a grant. This is a reimbursement process, just like the rest of healthcare. But if everyone who needed substance use disorder treatment that was engaged in one of our programs sought that treatment, this is the estimate of how much additional resource we would receive. So the administrative cost will be at the administrative match that remains within that program. There are multiple different funding sources that we can utilize to help assist with that, and I think one of the ways that we've been very thoughtful about how this program is rolled out is making sure that we engage the systems that are already in place. So we have, and in the room, our managed care partners that help us administer HIP, and they have such incredible touch points with their members that we will rely heavily on those existing partnerships to make sure that this program works for individuals, and using our managed care partners for that process. Additionally, we have a parallel track moving with Secretary Blair Milo in enhancing our workforce readiness, and so we have, as we build this process, these will converge together, I hope, for a very meaningful and helpful process for all that are involved.
Putting it together of this year.
That's to say, does it need another appropriation or anything from the General Assembly?
We do not believe that we do. Thank you.
What's the key to lowering prescription drug prices, particularly in Indiana?
So the president and I are working on an aggressive agenda on lowering list prices and cost to the system from prescription drugs. I can tell you that I've only been on the job for several days, and I have had many interactions already with the President of the United States on this issue. He called me on his way back from Europe from Air Force One to talk about this question. He raised this at my swearing in. We've met in the Oval Office. He discussed this forcefully in the same terms in the State of the Union. And I've been meeting with most senior members of the administration already on our game plan, which we're working on around how we increase generic and branded competition of drugs to pull down cost. Competition always helps pull that down. How we end gaming of the patent system by branded pharmaceutical companies so that we get more low-cost generics out on the marketplace. How we can look at ways that we can bring the benefit of the discounts that insurance companies are receiving to the patient when he or she shows up at the pharmacy and can pay a lower out-of-pocket at the pharmacy. And then also importantly, how can we reverse the incentives in the system to create incentives for lower drug prices rather than the current incentives for higher drug prices that are in the system. So it is job number one with the president. I'm focused on this. The whole team's working on that. Thank you.
Can someone tell me how often people will have to prove their 20-hour work requirement and what the lockout period is?
Fantastic question. So to address your first question, this will be a part of the redetermination process. So we will assess all of those requirements just at the redetermination period once a year. We hope that the way that we will design this program over the year, that we'll have incredible communication back and forth with our members throughout, so that there will be no surprises and everyone's ready at redetermination to check the box and continue their enrollment. Second of all, I just want to make sure that it's very clear that there is no lockout with the community engagement program. If an individual is unable to meet the requirement at the moment that they are in the program, there is a suspension process, and we have created multiple pathways out of suspension and back into enrollment to make sure that individuals would have, we hope to never have to suspend anyone, but if they were to meet that suspension requirement, that they would be easily able to meet it and come immediately back into the program without a gap.
Mr. Alex, you spend a lot of time at Eli Lilly, one of the nation's largest drug manufacturers, and you weathered questions from people wondering if you can transition from speaking for big pharma to speaking to the average person. What do you want to say to Hoosiers to assure them that you are working for them in D.C.?
So my mission at HHS, as well as the mission of all of the 80,000 people that we have on that incredible team, is to enhance and protect the health and well-being of all Americans. That is all we are focused on.
Sure. Sorry. You're talking about 130,000, estimate of 130,000 able-bodied adults who probably could be covered under that gateway to work. Do you expect in 3 years that all 130,000 of those will be off of Healthy Indiana plan of working, or do you?
So let me clarify where the 130,000 approximation comes from. So given the information that we have about our HIP members currently, that's the pool that we start with. But we have an additional 12 criteria that we don't collect all of that data now. And so again, individual by individual, we will assess whether someone is eligible for the program. Additionally, there are multiple other ways to meet that criteria. And so the end number, we start with 130,000 approximately, and the end number most likely will be smaller than that. Our hope is that individuals are in school, volunteering in their communities, in gainful employment, whether they are remaining in HIP or have moved on to another healthcare benefit is not necessarily the end goal. It's that we're helping enhance the health outcomes of everyone that's enrolled in this program.
Thank you.